So we have seen in the recent years a number of progress, therapeutic progress, with, for instance, the arrival of immuno-oncology, but also some of the, of course, targeted agents which have made a great difference for cancer patients. Of course, the challenge now is to understand how to optimize the use of all these new treatments. So I think it's a message of hope. It's a message of hope for the patients, for the medical community. So we have seen substantial changes in the way drugs, but also in general treatments, its other modalities, surgery, radiation oncology are developed and brought to patients. We work now based on the understanding of the biology, based on mechanism of action, understanding a patient population through their biology, and of course we address the clinical research completely differently. We have seen changes like the capacity now to work, for instance, across tumor types. So new types of projects, new types of clinical trials, targeting more populations across histologies again. So I think we are really positioned today to really address drug development, treatment development in general, in a completely innovative way. So I think we have challenges because all these new treatments, they can make a difference. But the issue is how are we going to really identify true innovation, and how are we going to select the right innovation that needs to reach the patient. We have seen also many treatments which are efficient, are active, but they do not really translate into clinically meaningful endpoints for the patient, such as survival and quality of life. So the dilemma is potentially active drugs, but how do we transform into a really effective treatment, which can be also affordable so that all patients can access. So I think that's one of the major challenge for society and for clinical research to address really how we bring this innovation to patients. Our major achievement has been the development of an EU manifesto, which we have presented to the European Parliament this year, which actually addresses the need for optimizing therapeutic trials, optimizing a therapeutic strategy, where we can really define dose treatment, whether it's combination, whether it is sequence, but it's also addressing, for instance, specific population. So how are we going to achieve that in Europe? And this is exactly the center of the topic of our EU manifesto, which is really, I believe, great progress in terms of EU policy. And we really want to bring at the level of at the European level, a true dialogue for applied clinical research. So not necessarily exclusively clinical research for drug development, but also applied clinical research to really address key central clinical questions for patients. I think we have to be optimistic, otherwise we would not be doing such, I would say, very complex activity, sometimes challenging. So optimism is there. We see therapeutic progress, and that, I guess, what is really keeping us going forward, always developing more energy for such therapeutic progress.